Hello. Today we will explore the compelling science behind cannabis and its potential role in addiction management. Cannabis has been found to help reduce opioid cravings, decrease alcohol consumption, and support individuals in managing tobacco addiction. From easing withdrawal symptoms to reducing cravings and breaking cycles of dependency, cannabinoids like CBD are gaining attention as supportive options in recovery. Let's dive into the research and discuss how cannabis is making an impact on addiction recovery. Before we get started, please note that Merriam's Hemp does not give or substitute for medical advice. Merriam's Hemp specifically invokes the First Amendment rights of freedom of speech and of the press without prejudice. Any statements made in this video have not been evaluated by the Food and Drug Administration. Any products discussed are not intended to diagnose, cure, prevent, or treat any disease. Merriam's Hemp also recommends, when and wherever possible, that licensed local healthcare professionals be consulted. Defining addiction. Addiction is a chronic condition that affects millions worldwide, altering the brain's reward system and impairing decision-making, self-regulation, and emotional stability. It involves both physical and psychological dependence as individuals become fixated on substances or behaviors, disrupting brain signal pathways related to reward, motivation, and memory. Over time, addiction leads to tolerance, meaning individuals require increased engagement with the addictive behavior or substance to achieve the same effect. Withdrawal symptoms such as anxiety, irritability, and discomfort can occur when access is restricted. This creates a cycle where the brain becomes dependent on the behavior or substance, disrupting normal brain function and reinforcing cravings. The hippocampus and amygdala, involved in memory and emotional processing, also strengthen associations between addictive behaviors and emotional cues, making cravings harder to resist and increasing the likelihood of relapse. As a result, individuals can find it increasingly difficult to break free from the cycle as it becomes ingrained in brain pathways related to reward and decision-making. Cannabinoids like CBD and THC interact with the body's endocannabinoid system, which plays a role in regulating pain, stress, and addiction-related pathways. Cannabis for harm reduction and substitution in addiction treatment. Cannabis has emerged as a potential tool for harm reduction and substitution therapy in addiction cases, particularly for managing dependence on more harmful substances like opioids, alcohol, and tobacco. Research supports the use of cannabis as a safer alternative, offering a way to reduce cravings and withdrawal symptoms while lowering the risk of overdose. A study published in the Journal of Pain found that medical cannabis use was associated with a 64% reduction in opioid use, fewer side effects, and improved quality of life among patients managing chronic pain. For individuals struggling with alcohol dependency, cannabis may serve as a harm reduction strategy. A research paper published by the Drug and Alcohol Review revealed that nearly half of medical cannabis users reported substituting cannabis for alcohol. This substitution effect not only reduces the harms associated with alcohol use, such as liver damage and high-risk behaviors, but also contributes to improved overall health outcomes. Similarly, cannabis has shown promise in helping people quit tobacco. A pilot study in the Journal of Addiction Research and Therapy demonstrated that CBD can reduce tobacco consumption by modulating cravings and withdrawal symptoms. Cannabis has the potential to regulate stress, anxiety, and mood, which are often underlying factors in addiction that make it hard to break the addiction cycle. While more research is needed to solidify cannabis's role in addiction treatment, existing evidence highlights its potential as a safer and effective harm reduction tool. By offering an alternative with lower addiction risk and fewer adverse health consequences, cannabis could significantly transform the landscape of addiction recovery. Withdrawal management. CBD and THC may help alleviate withdrawal symptoms such as anxiety, insomnia, and pain, making the detox process more manageable. A February 2024 study from the University of Colorado at Boulder, published in the Cannabis and Cannabinoid Research Journal, examined the effects of commercially available cannabis on anxiety. This randomized trial involved 300 participants and is the first of its kind to assess how legal cannabis impacts anxiety symptoms. Given that 1 in 5 U.S. adults suffer from an anxiety disorder, the study's findings are significant. It highlights CBD's potential to provide sustained anti-anxiety effects without the psychoactive risks associated with THC, suggesting it may effectively support individuals on their path to recovery. Neuroprotection. CBD has been shown to potentially mitigate brain damage caused by long-term substance abuse, most notably in critical regions such as the prefrontal cortex, which governs decision-making and impulse control. Research indicates that CBD enhances blood flow to the orbital frontal cortex, supporting its role in improving cognitive functions and alleviating impairments associated with substance use disorders. Additionally, CBD's capacity to regulate emotions, enhance memory processing, and reduce symptoms of psychosis further positions it as a beneficial tool in addiction recovery efforts. These findings align with evidence that high CBD, low THC cannabis can mitigate addiction-related stress and promote neurogenesis, further aiding rehabilitation efforts. Additional studies are needed to determine the long-term impact and optimal dosing strategies for these benefits. In conclusion, CBD has been found to alleviate withdrawal symptoms, reduce cravings, and improve emotional regulation in people recovering from substance use disorders. While cannabis might not be a one-size-fits-all solution, it offers promising alternatives to traditional addiction treatments, especially when combined with other therapies. As the research continues to evolve, it's essential for individuals to work closely with healthcare providers to determine the most effective treatment strategies for their unique situations. Thank you for joining this important discussion on cannabis and its potential role in addiction recovery. If you found this video insightful, please like, share, and subscribe to our YouTube channel to support this conversation and stay updated on future topics. Your engagement helps us to reach more people who could benefit from this information. Take care and see you next time. Bye-bye.